Hello all and welcome. Today we will discuss about the Naranjo scale. So Naranjo scale is used in the measurement of the causality, and we know that the causality is a relationship between the drug and the event. So Naranjo scale consists of 10 questions and each question has their own scoring. So in this way we can measure the causality by using a Naranjo scale. So let's get started. Our first question is, are there previous conclusive report on this reaction? So suppose person is on a paracetamol therapy, and after taking the paracetamol patient develop a skin rash. So in this case we have a patient, we have a drug, and we have a event. Our drug is paracetamol and our event is skin rash. So if there is previously such report is there, then we gave the plus 1 scoring. If no, then we put the 0. If we do not know, then we put 0 and we will put the total score here. So next question is, did the adverse event appear after the suspect drug was administered? It means patient taking the paracetamol, and after taking the paracetamol the patient develop the skin rash. Means after taking the drug the patient will experience the adverse event. So in this way, if it is due to drug, then we will capture here +2. If it is no, then we will capture -1. If we do not know, we will put 0 and we will mention the total score here. So next is, did the adverse reaction improve when the drug was discontinued or the specific antagonist was administered? It means that when the patient is on paracetamol therapy, and after the paracetamol therapy the patient will develop the skin rash. Now we will discontinue the drug and their adverse event is also disappears. So it means that if it is yes, then we will capture +1 here. If it is no, we will capture 0, and if we don't know, we will capture 0 and we will put the total score here. Now next question is, did the adverse event reappear when the drug was re-administered? It means suppose at the initial stage we give the paracetamol to the patient develop the skin rash as a adverse event, and after that we will stop the drug and their adverse event, that is skin reaction, is disappeared. Now we will reintroduce the drug into the patient, and the patient will re get the the adverse event. So if it is so, then we will capture here +2, and if it is no, then we will capture -1, and if we do not know, we will capture 0 and we will put the total score here. So next is, are there alternative cause other than the drug that could on their own have caused the reaction? It means that the patient is taking a paracetamol which causes the skin rash, and we have to identify that is there any previous history or any medical history of a patient that patient has right now, so that they trigger the adverse event. So if it is so, we have to capture +1 here, or if it is no, then +2. If we do not know, then we have to capture 0 and we have to capture total score there. Next is, did the reaction reappear when the placebo was given? So placebo is basically inert substance without active pharmaceutical ingredient. So suppose patient develop the adverse event because patient is on paracetamol therapy and patient develop the skin rash. Now what we will do, we will stop the paracetamol and we will give the placebo. Placebo is an inert substance, and we will see that the adverse event, that is skin reaction, is reappeared or not. So if it is so, then we will capture -1, and if it is no, then we will capture +1, and if we do not know, we will capture 0 and we will put total score here. So next is, was the drug detected in the blood in concentration known to be toxic? So we will take the blood sample of a patient and we will monitor the drug concentration in the patient, that it is toxic level or a not toxic level. If it is yes, then we will capture score +1. If it is no, we will capture 0. If we do not know, then we will capture 0 and we will put the total score here. So next question is, was the reaction more severe when the dose was increased or the less severe when the dose was increased? So suppose patient is on a paracetamol therapy and patient took 500 mg paracetamol, and after taking the paracetamol therapy, patient 500 mg tablet of paracetamol, patient developed the skin rash. So what we will do, we will increase the dose, that is we will give the 650 mg to the patient. If again patient will develop the severe adverse event, then it is a drug related, and we can also do that, we can decrease the dose, we can give the 250 mg to the patient, so that we can see that their adverse event is decreased or not. So if it is so, then we will capture +1 here. If it is no, then we will capture 0. And if we do not know, we will capture 0 and we will put the total score here. So next is, did the patient have similar reaction to the same or a similar drug in the previous exposure? So means paracetamol is, we know that it is a NSAID. So if the patient have similarly with the other NSAIDs, then we will capture here the +1, or if it is no, then we will capture 0, and if we do not know, we will capture 0 and we will put the total score here. Next is, was the adverse event confirmed by the objective evidence? If it is yes, we will capture the +1 here. If it is no, then we will capture 0. And if we do not know, we will capture 0 and we will put the total score here. So after all this scoring, we will find out the total score, and based on the total score, we can conclude that our causality is definite, probable, or a possible, or a doubtful. If it is definite, then our score is more than 8. If it is probable, if our score is equals to 5 to 8. If it is possible, our score is 1 to 4. And it is doubtful causality, then it is less than 1. So this is basic about the Naranjo scale. Thank you.